Cerebral palsy. Definition: static, non-progressive, neuromuscular condition comprising a series of syndromes that result from damage to the brain. Incidence: approximately 764,000 persons in the United States have some degree of cerebral palsy. About 10,000 babies born each year will develop cerebral palsy. 40% to 50% of children born with cerebral palsy are premature, low birth weight, or both. Etiology: prenatal, genetic or congenitally acquired, anoxia infections, alcohol or drug abuse, Rh incompatibility, metabolic disturbances, lack of folic acid. Natal: anoxia, hemorrhage. Postnatal: head injury, infections, neoplasms, anoxia. Classifications: motor disorders, spasticity. Slight stimulus causes exaggerated muscle contractions, stiff and jerky movements. Athetosis: muscle contraction involuntarily. Difficulty bringing the body to the upright position. Ataxia: muscles respond to stimulus but cannot complete a contraction. Low muscle tone and poor coordination. Hypotonia: unable to respond to volitional stimulus. Rigidity: increased initial muscle resistance, gives way with minimal force. Mixed: two or more types appearing in the same person. Limbs involved: monoplegic, one limb. Hemiplegic, both limbs on the same side of the body. Paraplegic, lower limbs. Diplegic, like parts of either side of the body, both lower limbs, both upper limbs. Quadriplegic, all four limbs. Triplegic, 3 limbs. Signs, symptoms, and clinical manifestations: characterized by paralysis, weakness, muscle spasms, incoordination, or other aberrations of motor function, especially involving voluntary muscles. Joint immobility and contractures increase with age. Retain primitive reflexes, asymmetrical or symmetrical tonic neck reflex. Other associated conditions: speech and language disorders, hearing disorders, visual defects, developmental and cognitive challenges. Seizures: wide range of limitations from mild to totally dependent. Oral manifestations: marked variation among individuals. Higher incidence of bruxism, dental caries, enamel dysplasia, malocclusion, and periodontal disease. Drug-induced gingival enlargement if phenytonin is used. Oral motor dysfunction, impaired swallowing, and mouth breathing. Temporomandibular joint disorders, TMJ, increased gag reflex, drooling, trauma resulting from incoordination and frequent falls, attrition and possible TMJ disturbances from mouth sticks, increased dental caries as a result of surgery to control saliva and drooling.